I went to Florida for a week and still wasn't that informed, and I was still optimistic because people beat the odds all the time. So I came back and I had, from that point on, I did my treatments. I did 6 months of chemo. I knew my odds were 50%. I had my scans every 6 months. In December of 15, I was told that the cancer was now terminal. It had metastasized to my lungs. And then I had to come back and get chemo for January. Darn again, I was planning on spending January in Florida. And at this point, I had a choice between Yondelis, which had just been approved. It's a newer chemo. Sometime at the end of 2015, it wasn't available when I was first diagnosed. And Penn Medicine was conducting a clinical trial. And the clinical trial was Adriamycin, they call it the Red Devil, it's awful, along with an antibody. But it was a double-blind study. And in the double-blind study, you could get placebo, which my guess I had, because it did nothing for me and I was taken out of the clinical trial at the end of 3 months. And that drug went on to be approved very quickly for leiomyosarcoma, is saving a lot more lives, and is now the first-line treatment for my disease. So it's not going to help me because I can't have it again, but I'm really thrilled with that progress because I have a feeling that I know that a much higher percentage of people will be cured in the first line of treatment because of that step forward. And then Yondelis, I went on in April through December of last year, 2016. And Yondelis for me is the only reason I'm here now. I was supposed to be gone by last summer, so it gets a little emotional. So Yondelis is a milder chemo. I made it 8 months on that before I really felt like I can't take anymore. And it's kind of nice because my hair grew back. I was able to do the infusions at home. I was allowed to get a lot of the care at home. And it wasn't that bad. It was a three-week cycle. I would bounce back. So I think all of that aspect, the chemo is pretty much like everybody's story. And then 3 months later, or a month later, because of Yondelis, I was eligible. It stabilized my disease in all but 4 nodes in my left lungs, and it was a quick turnaround. I had been told I wasn't eligible for lung surgery, and now I was. I was not told I would live. There was no pretense about that. But I had the surgery, and I recovered in 2 months, and I stayed stable until June of this year. The cancer is now growing again, but slowly, and at some point, I will, maybe in October, or maybe in January, I'll resume treatments, for as long as my body can handle it, or pursue clinical trials.